Hello, and welcome back to the Long Distance Love Bombs podcast. I am your host, Dr. Jeremy Goldberg, and my guest today is Dr. Pamela Douglas. This is a continuation of my exploration into the parenting industry. It is a continuation of my selfish pursuit of an easier life where I can be the best parent and partner I can be. And Dr. Pamela Douglas has come highly recommended because she is an Australian GP. She is a researcher. She is an author. She is a speaker. Over the last 20 years, she has published the evidence base to programs known as Neuroprotective Developmental Care, which is known as NDC, or what she calls the Possums Program. She has developed groundbreaking work and has detailed that and published more than 30 international research publications. She's also written a best-selling book called The Discontented Little Baby Book. And she is so kind and so gentle and so thoughtful. I loved this conversation, and it went on for much longer than I anticipated. And in the first 10 minutes or so, we kind of get into the weeds of science and research and what that means. And I could have dorked out on that for a long while. But then I remembered, hey, Jer, you're hosting a podcast, and not everybody is as big a dork as you are. And that's not what you're here to talk to her about. You want to talk to her about breastfeeding and sleeping and crying babies. Remember, man, focus, get your act together. And so that's what we do. We get our act together. Well, Pam always had her act together. I get my act together, and we dive into the topics of breastfeeding and babies and sleeping and sleep training. And there is so much practical, pragmatic information in this conversation that I left feeling stoked. I left feeling excited. I left feeling like any new parent or parent-to-be could listen to this and watch the video of it as she is demonstrating the holds and the techniques and the practices. It's really good. I have a lot of time and respect for Pam, even though we've just met. I appreciate her approach to lean on the evidence as directed by scientific research. I think that's important. She seems quite grounded in fact-based training and teaching, and she's just so likable. She's like the friendly neighbor you've always wanted. She is patient. I tried to get her to talk about a little bit of controversial stuff, and she is so professional that she resisted that a little bit, and we had a great time. So enjoy this conversation with Dr. Pamela Douglas. I've put links in the show notes to all of her stuff if you want to read more. I've been talking to Kendra about perhaps signing up for her Possums program. And yeah, any questions, any suggestions, any recommendations, please feel free to reach out. Thank you for sharing this. Thanks for the 5-star reviews. Every little bit helps. And that's it. Have a good time with this one, and maybe get a pen and paper because there's a lot of juicy content in this. Like, did you know that you didn't have to burp babies? That was news to me. I didn't know that. Anyway, I'm rambling. Enjoy this chat with Dr. Pamela Douglas.
Well, the question I had for you, Jeremy,
Okay, yeah, just straight into it.
was when is your baby due? When's your baby arriving?
So we're recording on August 13th, and my baby is due August 31st. So we are in week 38 right now. And this is maybe a great time.
Many times.
Yeah, about an hour ago, I was sitting in the office of our midwife, watching Kendra's belly get measured and listening to the heartbeat. And
Yeah.
they told us that the head has now descended a little bit below the pubic bone, which I just learned is a thing that happens a couple weeks before the big day. So yes, and maybe this is a good chance for me to just provide a little bit of context to you, what we're doing here, and maybe to the listener if they have no idea who this knucklehead is that has tricked you into speaking with them. But I have been working in the personal development industry for years now, and I'm very across the big names, the big topics, the charlatans, the like conspiracy theory ideals. I sort of have found my way and I know what's what. And now that I am an expectant father, soon to be father, I've been dabbling in the parenting literature because I'm a science dork. I'm curious. I also want to make my life easier and do the best job that I can. And my initial response to all of the parenting information out there is like, whoa, okay, there's a lot of contradictory information. There's a lot of opinions. There's a lot of what seems like tribalism and confrontational advice.
Yes.
And I have been reading and digesting and listening to podcasts, etc. And I reached out to Amanda Ruggieri, who's a BBC journalist who was on the podcast talking about how to find and trust experts. And she basically turned her travel journalism career into a parenting journalism career. And she said, you've got to talk to Pamela Douglas. She is like the OG. She's reputable. She's a scientist. You need to try and get her on the podcast. And I was like, okay. So here we are. And so I guess it's twofold. One, personally, I would love to just pick your brain for an hour about my impending life-changing initiation and how to best navigate that. And secondly, to those listening, I think anything that you have to say about the parenting industry, it seems so weird to even say that, the parenting industry, but
it is an industry.
Yeah. And so maybe as a starting point, you can just describe who you are, because I know you have a lot of letters after your name in your email signature, and you seem very reputable.
I try to be reputable, and I'm grateful to Amanda for her vote of confidence. And it is a real pleasure on this eco holiday in Brisbane, Jeremy, to be having an early morning chat with you. So I'm a GP. I've been a GP since 1987, and I also did qualify as an international board certified lactation consultant in 1994, which was in those years of having babies and tiny children myself, actually. As a GP, once you have children, particularly the female GPs find that a lot of women with babies and small children start coming to see you. And I, had become very interested in breastfeeding. So I have practiced as a breastfeeding medicine physician and lactation consultant since then. But in the context of my generalist practice. And then really from the late 90s, I became very interested in a phenomenon that started here in Brisbane, actually, which was the diagnosis of gastroesophageal reflux disease in babies. And I could see that what was happening was that undiagnosed, unmanaged breastfeeding problems or feeding problems were being given this label. And I began to research, began to really start to look at what was going on there. And so by 2005, I published my first research paper in the medical research literature, and have been building up an evidence base since then, really, to this suite of programs that people know as the Possums Programs, or health professionals call Neuroprotective Developmental Care. And and this is across, breastfeeding, feeds, cry fuss problems, sleep, and well-being, all embedded in trying to make sense of the socio-cultural context and evolutionary context, actually, in which we're raising our children. So that's a bit of a wrap on me.
Yeah. And you, just to further your credentials, I saw that you published scientific papers and you're doing research on things like breastfeeding and lactation and sleep and
yes.
So you're like a scientist, doctor, researcher.
Yeah, that would be one way of saying it. That's right.
Is that how you would say it though? Like how do you view yourself?
Yeah. Well, I certainly am very proud of being a GP, like a generalist doctor of family medicine practitioner, GP, because it's a particular brain that we have as GPs that really is interdisciplinary, that's very interested in the context of what's happening in the body, what's happening with illness, or what happens when all these problems come up for parents with their bubbies, women with their bubbies, dads with their bubbies, parents, non-binary gender with their bubbies, and so lost my train of thought there. But
you do it all.
Question?
Yeah.
That's right. I was going to say, so you asked me what I identified with especially, and I guess that generalist brain that's so interdisciplinary, I think that brings a particular set of lenses to the research literature and then to how one works with families with babies. So I was going to say that I actually love to write, and I love creative writing. I have just the one published book. I have others there that quite published, but that's the Discontented Little Baby Book, which is also, directed to parents with bubbies. So I guess that's a big part of my identity, and I'm very interested in the research, because that's the discourse of our times. That's how we make sense of our embodied experiences, actually, in a way that's it's one of the ways. It's one of the very important ways, and I think it's a way in which I can make a real contribution here, keeping what I offer to parents and babies really embedded in data and research, in the scientific discourse. And I suppose if I'm saying that, I'll probably just add there are three lenses that I use, that I bring to bear when I'm making sense of data, because it's all about how we make sense of data, isn't it, Jeremy? And being explicit really about the lenses that we use. Anyway, evolutionary biology, complexity science, and then that generalist, interdisciplinary, holistic kind of brain.
Yeah. So you just to summarize. Yeah, well, I mean, I'm perhaps not the best person to keep us on track, as I love meandering through the woods. But it sounds like what you're saying there is, if I may attempt to paraphrase from my own understanding, is parenting is complex. It's got multiple influencing factors such as society, culture, family, sort of like intuition in there. And there's now a lot of research and evidence-based science that helps to inform some of the ways that we do things to raise little ones in the world today. Is that fair?
Yes, I think that's
Okay.
fair. That's a great summary. I think I'd have to say that there are areas of my particular interests that they've not really had a very big research focus. So there are areas in which the health professional community flounders around a bit without a lot of evidence to draw on, and that's when that's when we have to be really clear about the kinds of theories that we're relying on, because we haven't got a lot of data or a lot of meaningful data, because there's so much data, but a lot of it's really methodologically weak. That makes sense.
Right.
So this, I'm thinking here particularly around breastfeeding, for instance. And
just to clarify for the listener, when you say methodologically weak, that in my brain is like, it's very difficult to study these things. It's difficult to devise experiments to figure out what's really happening with these things, or the studies that have been done are poorly designed and perhaps not as reliable as they may first appear. Is that accurate?
There's a lot of poorly designed studies out there. You would know this, I think, yourself, how the studies that we conduct really depend on the questions we're asking, which kind of depends on our own. There's that whole area of subjectivity, see, in how we set up research. And if we're not really explicit about our kind of lenses, about how we're setting out to ask questions, then we set up research that has all of these unexamined assumptions, and then we interpret it through all of these unexamined assumptions. And this is where ideology can have such a big part to play in parenting, because a lot of research can be set up through very ideologically filtered kind of lenses, and then it's methodologically weak. You see, it's not rigorous. It's got all of these unexamined things confusing what's going on. There's a lot of that out there in the parenting space in terms of research, Jeremy. So one has to be really sort of analytic, like really critical about how we make sense of the research out there, because everybody says that everything they're doing is evidence-based now. Evidence-based is a kind of descriptor that's become a marketing tool. So you'll see everyone says, come and do this evidence-based program with me. I'm evidence-based. This is, in the science. Like it's a marketing tool now. And in fact, the devisers of evidence-based medicine have research publications in which they've said this term has become a marketing tool.
Right. And so they might manipulate the potential purchaser or the public by saying evidence-based, when the evidence might be me and my baby, right? Sample size of 1, for example. But hang on, before we get too far down the weeds of scientific rigor, because I know that both of us seem like big dorks and we would love that. But for the average person, they're like, yes. Yo, I just want to know how to raise a baby. I'm curious if we could talk about Neuroprotective Developmental Care. Do I have that written down right?
Yeah.
What does that big fancy phrase mean, and why does it matter?
Yeah. Well, people just know it as the Possums Programs, really. But the term neurodevelopmental protective care it flags how these programs actually optimize infant development, optimize the well-being of the parent. This is the intention, this is the aim of these programs, to optimize infant development, optimize parental well-being, and to basically grow joy in early life, which, to grow enjoyment and ease, pleasure in that baby, because that's so good for the family, for the well-being of the parents, and of course for that little one's developmental outcomes.
Yeah.
So it's looking at brain science, and in both the baby and the parent, and what happens in the gut. microbiome, and that kind of the aim is a kind of holistic wraparound care, really, that just helps parents find their own power and joy, actually, in parenting.
Okay.
Parents are the experts, actually.
Yeah. So how do I do that, Pam? How do I do that? If parents are the experts, which is me, soon to be parent, but I feel like a knucklehead imposter who's never done this before, and I know there's a bunch of experts out there who are saying different things.
Yeah.
Maybe we could pick apart like sleeping and breastfeeding as big examples.
Yeah.
What do I do, Pam? How do I do this? Help me out.
Yeah. Well, we're all knucklehead imposters, really, when we start out on this. Like, none of us know. For instance, the baby, right from the moment that little sweetheart emerges into the world, will be communicating. None of us really know what the baby's communicating or cueing, you might say, communicating, but we start experimenting. And it's that experimenting as parents that becomes a great strength. So we try out one thing, doesn't seem to work. We try out another thing, maybe it works for a while. So, I'm always saying to parents that, I might have the view that what I'm going to offer you is evidence-based, and might have the view that it will be increasingly mainstreamed, and as the years pass and so on. That's my belief, but it doesn't help parents. In the end, parents just experiment, particularly in this context, Jeremy, where there is so much conflicting and confusing advice. Parents will just try out some things, see if it works in their own unique context. If it doesn't, they'll drop that, they'll try something else. And that is a source of enormous resilience for families. None of us know what's going on when we have a bubby arrive, and in 2 weeks' time, well, if the little one waits another 2 weeks, it is on the threshold of the great unknown, tremendous mystery, really, and quite intimidating and terrifying. But like parents, really, from the dawn of time, you'll just experiment your way through by listening, watching, responding to that little one. The responding, the desire to respond is very deeply biologically hardwired in us as parents. And it's that responding and seeing what happens, and the to and fro little communications. That's your power. We do live in a society where parents will get advice that actually disrupts, that undermines our confidence around responding. And I'm thinking here, Jeremy, particularly of sleep, for instance, where there's been a big focus on, you might call them the sleep training methods, actually, although very often now sleep coaches draw on sleep training methods, but they won't call it sleep training. They might call it responsive settling. But actually, much of the advice that's been mainstreamed in our society around infant sleep can really disrupt that getting in sync with your bubby, that to and fro communicating, listening to the baby's communications. So that is a whole big topic, that one. And of course, how I mentioned the reflux bit earlier on. Well, parents will often get advice in, say, breastfeeding difficulties, that what's happening for the bubby is, say, a medical condition which disrupts their capacity to keep experimenting and trying to sort out why that bubby's dialing up, why that little sympathetic nervous system is dialing up. Am I making sense here?
Yeah, I think so. And so just to like double click into that last one, the idea would be, I think, that a baby is having some kind of gastrointestinal digestive issue, and they'll be treated as that rather than the core sort of root cause, which might be how the position of the breast or the something like this.
Yes, you've been doing some research there because
I've been snooping around on you, Pam.
because
Don't just have anybody on these podcasts, you know?
because that's a big one, that whole embodied, how do we get this little bubby to fit into the breastfeeding woman's body in a way that kind of works for both of them so that doesn't cause her pain and that keeps that little one stable and dialed down and deeply relaxed. Well, when things aren't quite going right there and that little one dials up, so the little one doesn't have a good stable position, for instance, it's very often medicalized as, well, it must be gut pain that's making the bubby sort of wriggle and pull back or get upset. Or if it's not gut pain, it might quickly go to allergy and it's not to say we don't want to miss true allergies, but actually much of this is serious overdiagnosis. People might say, oh, it's a lactose problem or something to do with the baby's microbiome, gut dysbiosis, or and so we've got this big blind spot, for instance, around the whole thing of fit and hold in breastfeeding in our world, I would propose.
Actually, that was a question I had for you because I read somewhere this Gestalt method of fit and hold, but I'm familiar with Gestalt therapy and Gestalt institutes, but I have no idea what the method of fit and hold means. Can you?
Well, a dear friend of mine had suggested, a former husband of mine had suggested Gestalt as a word because I needed a way of describing the method, the approach that I'd been developing up in the clinic over many years working with women and babies breastfeeding. And Gestalt, of course, means a whole that's more than the sum of its parts. And this was in the context of a very big sociocultural focus on oral connective tissues, actually tongue tie. And so I needed a way to sort of label the approach that I was using and wanted to show that we're really looking at the way the whole of that woman and her body and baby's little body with all their glorious anatomic variabilities were fitting together and that this was more than just one part or the sum of parts. So that was why I have used the Gestalt method as a way of describing what approach this is. And it's true that there's just one study that I've been able to put together to evaluate it, and that was with the University of Western Australia's Human Lactation Research Group using ultrasound, and they have shown in that small case series, so it's just the beginning of layering up evidence, how we have to sort of evaluate over and over again using different methods, but that the ultrasound measures after a brief Gestalt intervention were consistent with the kinds of changes that you see with improved milk transfer, less pain. So it was actually a very positive outcome in terms of the data in this small case series, because all this small series of women had ongoing serious problems with comprehensive lactation consultant interventions prior.
And then what's the intervention that was done?
Well, if everything's going really well, if it ain't broke, we don't need to fix it, right? So women just experiment their way through from that first skin-on-skin contact, the little ones, mammalian reflexes start to activate, and that bubby can actually start to find their way down to the breast and women just sort of help a bit. And so we actually don't need to interfere if all's going well. But as soon as a woman has nipple pain, for instance, and unfortunately this is very common for our women, like 75% or so more, as soon as that little one is fussing and having real difficulty coming onto the breast, and we want to be very patient and give bubbies lots and lots of time, these little newborns who've just arrived in our big old world. But if there becomes a real problem around little one coming onto the breast, and so that's when we don't want to delay too much. We want to start supporting her with some strategies to experiment herself with how to get that little one really stable against her body, at her breast, breastfeeding. And in fact, I do have the view that, there's just a few things before the bubby arrives that would be really helpful for all parents to know. This is my view on it. And one of them is just some basic sort of little skills that a woman can pull on if she finds she's starting to get nipple pain, or there's a lot of dialing up by that little one at the breast. Because, of course, often cascades of distress quickly come about in these first days and weeks. And I have the view that much of it's actually preventable, but our health system does have a big blind spot around this thing of fit and hold, actually.
So hypothetically, if there was a new parent to be in a couple weeks, like what would be things that could help prevent what did you say, a cascade of catastrophes or something?
Well, of distress, I think was what I actually said. Hesitate. Parents feel it as catastrophic, because every cell of our body wants that little one to be happy and to be completely wrapped around with our love and da. So parents, when babies become upset and when things aren't going well with breastfeeding, it is extremely upsetting for parents. Breastfeeding problems can be devastating for breastfeeding women, because, as I say, every fiber of our being kind of biologically, very often, and this isn't true for every woman, and that doesn't mean that the woman for whom this isn't true is any less, devoted or maternal or whatever. But for many of us, it's like this great biological drive to be able to breastfeed. And so when it's not working out, it can be very distressing. So cascades of distress can quickly take hold, really, between both that breastfeeding woman and the bubby. And I look forward to the day when our health system has more effective ways of coming in very early on to support that complex system, really, that ecosystem of the breastfeeding woman and her bubby and the parents, that loving other, if she's fortunate enough, as your partner is, to have a deeply engaged other loving parent there, hands-on.
And so is it as simple as finding the right posture and position and taking care of the skin and the area? Or like when you talk about preventative things you hope everybody had?
Yeah. Well, there's nothing a woman has to do to her skin or nipples, for sure. She doesn't have to, unless she's had inverted nipples, but that's a whole other story. But it's more knowing how to turn on the baby's breastfeeding reflexes. So being semi-reclined in, say, the 45 degrees really helps. And it's knowing how. See, now I'm about to reach for my doll to explain this.
Let's go. Yeah. I love that you just have a random baby doll there.
I could just feel my body wanting to stuck down towards.
Yeah, so so to those that are listening to the podcast, now would be a good time to like find the video, because there's a fake baby has entered the building.
That's right, Timo.
Okay.
It's a big part of my professional life. Yes. Yeah.
Okay. What's up, Timo?
It's when that lower half of the bubby's face is in contact with the breast, that turns on breastfeeding reflexes actually. And so often in those first days, what has happened in the hospital is that the staff really promote skin to skin contact, which is great. And so that smushing in to the skin or up above the breast, it turns on the bobbing, the oral seeking, little one's head goes from side to side, does a lot of bobbing and panting, Um, and a woman will be just sort of helping the little one on, mouth over nipple any old way, which is how you want to do it, actually, just helping the little one on. The chest and tummy really flat against the woman's body, torso, really helps turn on those breastfeeding reflexes. And the little hands, which seem to be everywhere getting in the way, but that patting and sort of that's we want the little hands there, and often we just sort of might gently encourage the hands to be wrapping around the breast. We actually don't want them between the bubby's body and the mum's body. But if the little one's flat chest and tummy up against the body, and then so in those early hours, just understanding that micro movements can make the world of difference. If a woman is tuning in to the sensation in her breast and nipples and something doesn't feel quite right as the little one's sucking reflexes are activated so the jaw drops down, then what she would want to do is all these little micro movements to see where it feels better. So you're just going, is that better? Is that worse? Oh, that's a bit worse. I'm going to try the other direction. Now, I can go into how we formally do that as an intervention, but at the minute, if we're just thinking, say, your own little bubby arriving in the world and your own partner experimenting, it's just often if something's not feeling quite right, we tend to freeze because it doesn't feel very pleasant. But knowing, just this simple thing of knowing you can keep doing all these little movements to make sure that we're not getting breast tissue drag. So see, if this is a knitted breast, I'm just illustrating here to you how when the jaw drops, a vacuum's created and the bubby's incrementally drawing up more and more breast tissue. Babies typically come on very superficial. That's normal. You don't want to take them off, but you do want to start your micro movements to make sure that we're not getting breast tissue drag, which I'm exaggerating as I'm showing you now with the knitted breast, but actually subtle movements can just make sure that we're not dragging on that breast tissue, but it's being directly drawn up nice and deeply into the little one's mouth. Now, sometimes a helper, a health professional will have little strategies. I teach the health professionals little strategies that can help women fit the bubby into their own body, but often just knowing that you can do all these micro movements and experiment to make sure it's feeling right. It'll feel strong. Your partner is likely to be astonished by how strong it feels, but we don't want it to hurt. We don't want it to feel bad. And she would have the power to just be experimenting with all of that, which is just a simple thing that women often don't know. It does mean hospital chairs, often, believe it or not, they often can get in the way of breastfeeding because those solid arms up close can interfere with the space a woman and her baby need to sort of be playing around with fit and hold. But if she remembers even sitting up in the hospital bed, 45 degrees, the nurses typically these days for skin-on-skin contact are very aware of being in that sort of laid-back posy with the lap open, so there's lots of room there for the little one. probably one other little tip for a woman who's just that minute given birth, if she's got any discomfort at all, she'll have this beautiful round post-birth tummy, and sometimes it's best to get the little one up right under her other breast, way up above that post-birth tummy. That's one little trick that can really help a woman if she's getting any discomfort in those first hours and days.
Yeah, that's helpful. I love also that you have a knitted breast. And to those listening, yeah, Pam was like moving the nipple all around left and right, and like this is perhaps a more visual episode than others, and I think it needs to be that. But that's really helpful. I appreciate you sharing the specific examples, because I'm thinking of my partner of like,
yeah,
I want her to watch this and learn from some of these tips ahead of time.
And maybe the other important thing for a woman who's wanting to breastfeed is to know just how important frequent flexible offers at the breast are in those early days. So you might hear the phrase demand breastfeeding, and I tend not to use it just because frequent flexible feeds is a lot more frequent than you would even think when you hear about demand breastfeeding. It's just offering the breast whenever A, a woman feels like it. Actually, we don't have to be waiting for the baby to communicate, or B, when you think as parents that the little one might be communicating that he or she is wanting the breast. And and so I'm often saying, and you kind of don't need to count, but just to give parents a sense of this, 12 offers each breast in a 24-hour period would be absolutely normal for most women if they're wanting to really build their supply, maintain their supply, and maintain the baby's weight gain. And so that's a lot more than we think in our society, but it doesn't have to be for long. That's the other thing. Ladies, even in the hospital, might be given the idea that they've got to be draining the breast or holding the baby on the breast for a certain period of time. But I would propose we don't even need to think of times at the breast as meals. We're using the breast to dial the little one down, and it can be just for a short period of time. So, once breastfeeding's established, the truth is about 60% of the milk is transferred within the first 2 letdowns. Women mostly don't feel their letdowns, so you don't have to think like that. But I say it because it just communicates. It doesn't have to be long at the breast, but it has to be frequent for most women. Some will get by, baby gains weight beautifully with just 8 feeds in a 24-hour period or whatever. But for most of us, actually, it's a lot more frequent than you think, but it doesn't have to be for long.
And sorry, what's a letdown?
Yeah, so the letdown is formally known as the milk ejection reflex, but it's when the little one comes to the breast, on the nipple is dropping the jaw, the tongue folds around the nipple and breast tissue that's drawn up like a sensory bath, really. And that then triggers the oxytocin release. So the message is traveling up through the sensory nerve system, trigger oxytocin release, and the oxytocin causes the milk glands to contract. So it causes the little cells around the outside of the milk glands to contract, the myoepithelial cells. And so that happens, it's not like a machine, but it happens like this wave, or this rippling wave across the breasts of contraction of the milk glands, and then milk comes out. Now, in the first days, of course, it's colostrum, tiny, tiny drops, and we're not even thinking so much volumes or milk in those first days. We're thinking, let's use the breast to keep the little one dialed down, and then all that sort of magical colostrum, really so dense in immune protection, will inevitably come into the bubby's mouth in small quantities, and then transitional milk starts to come in. But that's what a letdown is. So some women feel it as tingling or even like a bit of a sharp pain sometimes. But often we don't even feel letdowns. But it's both the letdown and then the vacuum that's being created by the baby's mouth. That's how milk is transferred. So things you hear like lying back helps decrease the amount of milk. That's actually not true, because it's the amount of milk that's released isn't controlled by gravity. It's controlled by the contraction of the alveoli glands and then the vacuum.
Okay. That's helpful. Thank you. May I transition us to talk about a different topic?
Please.
So I had a buddy on my soccer team a couple weeks or months ago say to me when I inquired to him, like, "Hey, how's your new baby? Are you guys sleeping?" And this man looked at me and laughed and said, "Oh man, you're gonna get destroyed," right? Which didn't fill me with glee, I must admit, Pam. It gave me a little trepidation. But the topic of sleep in particular, I have been reading on, and it seems to me to be one of the most discussed topics, as well as one of the most polarizing camp versus camp type. I don't want to say battleground, but it feels tense in places that I've come across. This idea of sleep training versus not, and then even within sleep training camps, there's like a spectrum. And so now that I have a reputable writer, scientist, doctor in front of me, I'm curious, anything that you could share to me about sleep and mom sleep and baby sleep?
Yeah.
Even you're kind of grimacing there too, and that is also not the most reassuring.
It wasn't meant to be a grimace, but actually at that very minute, I was thinking of the last year. Actually, I spent a year creating up the Possums, this latest version of the Possums Sleep program that's now available online. So I must admit, because it's such a big topic, actually. And,
Yeah.
you know, and I think the distress, there is a lot of sleep distress, baby sleep distress in our families, and it can be, it's a serious matter. Like it certainly increases the risk of postnatal depression, not just for that woman, let's say, but for the other partner as well. Just careful not to sort of become too binary in the way I talk about families, because our families are very complex and variable. But for parents, it can certainly be a significant mental health challenge, the sleep situation.
Right. For the family unit as a whole, not just the mother and the baby, but
exactly
the others involved.
I'm wanting to say exactly. And yet, I would propose that much of the sleep distress in our society can be avoided. So that's not to say that nights don't become really very disrupted, particularly early on. You see in the first week, first couple of weeks, our little one's body clock, the body clock, circadian clock, is one of the 2 sleep regulators in humans. And babies are born with a very immature body clock. So there can be a lot of wakefulness in the night, which is when naturally parents are wanting to sleep, and big blocks of sleep during the day, which can feel a relief. But actually we can support the quick alignment of baby's body clock with our body clock. And so that's something useful to know in the very early days and weeks. But it would be fair to expect some seriously disrupted nights in the first couple of weeks. In a way, nothing prepares you for it. What we want is that families quickly move into a situation where they're feeling as though they're in sync with their bubby more or less. Their body clock is more or less aligned with the baby, or the baby's body clock really is more or less aligned with the parent's body clock. And so, we could talk about some of those strategies, but just to sort of address the sleep distress that's around. So instead of emerging out of what I think parents sort of expect to be a very disrupted first couple of weeks, it's like this little person is landing in the world, and kind of adjusting to day and night. But instead of coming through that to a situation where it kind of feels manageable, like sleep won't be quite what it was prior to having the bubby for quite some time. But there are ways in which we can make sleep more manageable. And in fact, we know that breastfeeding women actually get more sleep, as much or more sleep than parents who are needing to use bottles, actually. So biologically, from an evolutionary perspective, sleep shouldn't be as distressing and as disrupted as it is in our sort of 21st century world. And I think that we can track this real, if you like, often iatrogenic, so societally health system induced sleep distress back to the 1950s, middle of last century, post-war, actually, which was when that whole school of psychology known as behaviorism, which of course has been foundational, you'd appreciate, Jeremy, to so much of our psychological understandings about the human condition. But it was taken on in a very sort of first wave mode, if you like, by the hospital settings, which was where, come the end of Second World War, most women were giving birth, you see, whereas prior, the early part of last century, it was much more in the community, in the home. But all the benefits, safety benefits of being in the hospital setting, and we still don't do that neurohormonal getting in sync well, I would propose, in the hospital setting. So sleep training became a thing. It came out of first wave behaviorism. It sort of blended with scientific motherhood, what was called scientific motherhood, from the middle of last century. And actually, Jeremy, I was taught it in 1974 in high school in Queensland. We had to do mothercraft classes. The boys, lucky things, they went off to do woodwork. Well, the girls had to do mothercraft classes. And we were taught this. This was way before the advent of evidence-based medicine. So this is a socio-cultural approach. It's not, and in fact, so we were taught, don't let their nervous systems get overstimulated, space out feeds, don't feed to sleep. All of these precepts that I could list for you that come out of the sleep training approach, build up positive sleep associations, sleep breeds sleep, make sure they get big blocks of sleep, don't let them get overtired, overstimulate, all of that. That sort of thing I was taught in 1974 as a girl. And in fact, we have had the advent of evidence-based medicine, and there's 8 systematic reviews now, actually, of all the research into evaluating sleep training approaches. They do not decrease frequency of night waking for families. And in fact, I would propose are at the root of excessive night waking for many of our families, because the truth is, if we're trying to get these big blocks of sleep, we end up over time with very disrupted circadian clocks and unnecessarily fragmented sleep patterns in our babies. So there's developmentally normal night waking, which will be every couple of hours, often right into toddlerhood and beyond. And I know that sounds terrifying, but the thing is for everyone to get back to sleep really quickly, and in fact it becomes manageable. So there's developmentally normal, manageable enough night waking, which we can't really change, but we can find ways to manage so that our nights are workable and we're really enjoying the bubby. But then there's a lot of excessive night waking in our society and a great deal of distress around sleep because of messaging that's not evidence-based. Like if your baby's not getting these big blocks of sleep, your baby will have behavioral or cognitive challenges down the track. For instance, there's a lot of messaging there that's not evidence-based actually and really frightens parents. And so parents put in place these strategies that are meant to be optimizing sleep, but are actually over time making sleep unnecessarily disrupted. Families are ending up with excessive night waking, at which point they're told to put in place the sleep training strategies, which they may not even identify as sleep training strategies, but they're told to put them in place even more rigorously. That they come out of when I say first wave behavioural, that's the extinction or the graduated extinction methods being applied to infant sleep, but it completely misunderstands the biology of sleep.
And this is sort of an artifact left over from decades ago that has persisted in the culture. Is that right?
Completely dominant at the moment. So that advice that parents get about baby sleep as evidence-based advice may not be in any way labelled as sleep training advice, but it actually comes out of that package and is very confusing and often very worrying for parents. So every parent, parents, if I say you need to do this in order to get the best outcomes for your baby's development, then you'll walk over hot coals. Like parents will do, if they really believe that they trust that advice, they'll do whatever's required. But it can generate so much unnecessary sleep distress. And so I guess alongside the breastfeeding work, I've been quite passionate about making a contribution into this space, which has the name of the Possums Sleep Program,
So it sounds like there may be certain culturally accepted stories around sleep, such as if my child isn't sleeping in big chunks throughout the night, they will grow up and have learning disabilities, be lower IQs, problems, dramas, hardships, etc. Right? And so then if and then they do wake up multiple times during the night, I could see the parents being stressed, having those stories in addition to the lack of sleep, in addition to a crying child.
Yep.
And part of those stories might be I'm a bad parent, I'm failing my child.
Exactly.
I'm doing it wrong. And it sounds like what you're saying is that there is going to be a lot of wake-ups throughout the night, but there's a big difference between waking up for 5 to 10 minutes and 45 minutes to 2 hours or however long it's going to be. So like getting back to sleep most quickly.
Yes, there's that. And there's also every couple of hours, more or less, without watching the clock is very normal and to be expected. But so many parents have little ones now who are waking every hour, every 45 minutes as a pattern, every 30 minutes as a pattern through good parts of the night, very regularly. And that's also excessive night waking. And it's due to disruption of the circadian clock actually in that baby, which is an inevitable outcome. Say inevitable, but if you've got a high sleep need baby, then kind of you can do anything really and that little one's sleep will be quite manageable. But most of us have medium to low sleep need babies, you see. And so if we start to try to get these big naps during the day that you told babies or even toddlers need, then 2 or 3 weeks down the track, that family can start to experience excessive waking at night. And that's a kind of iatrogenic, health system induced excessive night waking. Because baby sleep needs are incredibly variable. So even your little newborn that we're anticipating, he or she may be at the low end of the sleep need spectrum. And I wouldn't wish it upon you, Jeremy, because it is hard work having a low sleep need baby. But there are newborns who only need 9 hours total in a 24-hour period and who are just taking, 10 minutes here, 10 minutes there during the day, maybe half an hour total naps during the day. Now, that would be extreme at the low end of the bell curve of sleep needs for a newborn, but they're there, they exist. And then at the other end of the bell curve, we have the 18-hour in a 24-hour period newborn sleep need. So twice as much. So you can see our baby sleep needs are incredibly variable, biologically variable. And so all the advice you see out there that gives estimates around how much sleep your baby needs and wake windows, how long your little one should be awake for before you start to try to catch that way. That's not evidence-based, actually. It's not consistent with what we know from huge cohorts now around normal baby sleep.
And so when you talk about the circadian rhythm, I think of the sun and daylight and dusk, etc. And newborn babies have that circadian rhythm built in. So is that like getting them light in the morning and avoiding bright lights in the evening? Like, is it that simple, or am I just dumbing this down?
No, you're right, really. What I would say is that their little circadian clock is not yet mature, but they have the capacity to respond to circadian cues, like those cues from the environment that you've just mentioned. Namely, light, noise, activity is the circadian cues, that correspond with daytime, and then it's quiet, dark, less activity in that big sleep at night. I always think of evenings as daytime. It's still light, noise, activity, and in fact, you'll get quite a lot of advice at the moment that we should be dimming lights in the evening for babies to bring on the melatonin. It completely misunderstands the sleep science. Melatonin doesn't control baby sleep, but it tracks the function of the circadian clock. So evenings need to be thought of as just day, light, noise, activity, because that kind of brings us to this whole concept of our baby's sensory motor needs. Our babies, and you can't really think about setting up relaxed, sort of manageable sleep for a family without thinking about a bubby's sensory motor needs, because this is another big blind spot still in our health system. And parents are much more likely to hear that they shouldn't be letting their bubby get overstimulated. That's so unhelpful, that advice, because our little ones are laying down their neural pathways in direct response to rich and changing sensory input across all their senses, and that includes vestibular stimulation like postural changes relative to gravity. They have a biological need or hunger for very rich environmental experiences. And of course, they'll dial up in low, particularly after about the first 2 weeks, because you'll find with your little newborn, the first week or two, it's almost like transitional. The little one often does quite a bit of sleeping, but after about 2 weeks, babies really start to dial up in the interiors of our homes, because our indoor environments are incredibly low sensory for bubbies relative to the outdoor world. And I'm sort of looking through the window at even just a tree and the complexity. Bubbies can't focus necessarily, but they see the play of light and shadow and complexity compared to a wall, And so no matter how hard we try to make our indoor environments interesting, they're just fundamentally low sensory, and babies quickly dial up inside the home. But because our society has such a sleep lens, then parents are told, oh, first tired signs, quickly get your baby down. And that's a great way to start the sleep wars or the sleep battles, which we just don't want. So if we take off the sleep lens and put on the sensory motor nourishment lens of, let's just get out and have the most interesting day possible for us as parents, with the baby coming along in tow, using our two tools to dial the bubby down. So is it milk? Well, on off the breast, if the bubby's breastfeeding, or even with the bottle, we can do paced bottle feeding. Or is it a change of sensory environment? And if we just go between those two tools all day long, then sleep really looks after itself, and we don't have to be trying to get babies to sleep. We don't have to be trying to keep them asleep. We're just wanting to have the most enjoyable possible days outside the home that we can have as a family, with the little one fitting in. And that's good for sleep helpful at night. Yeah.
Yeah, I'm picturing myself, like if I just laid on a couch and stared at a wall for the whole day, that I probably wouldn't be super sleepy at night. But if I laid there and I read and I thought and I watched and I was entertained and I used my brain and I was like feeling alive, I think I would be more sleepy at night. Is this what you're getting at?
There's something to that. But what I would say is that nevertheless, let's say you were in the sort of interior environment, you actually need more than that to feel well-being as a human, don't you? You need contact with an incredibly rich world out there, but also the body. You need physicality, you need movement. And our babies are the same. If we're going to optimize development, actually, they need a lot of movement relative to gravity. This is what happens when you're carrying a baby compared to a baby on a mattress. They're constantly having to make postural adjustments relative to gravity, which is so good for their developing brain compared to a mattress, for instance, which is not to say sometimes we need mattresses for our bubbies, but you can see from an evolutionary perspective. And then as the bubby gets bigger, all that physicality of interaction, the responding, even just the turning of the head slightly to respond, all of this, I sort of talk about the wraparound NDC or Possums approach to our little one's motor development, actually, because, again, there's blind spots here in our health system. But if we're holding the little one, it doesn't have to be all the time, but aware of the importance of the little one having all of this sort of motor experience, postural adjustment, vestibular experience. If we're interacting with our little one, then the bubby responding to us is also constantly triggering motor development, motor responses. And then, visual, auditory experience is so much more complex outside the home. Change of temperature, all of this environmental enrichment is actually, well, it's shown in the research to be really important for development. And yet a spillover from the sleep training approaches is often worrying advice to parents to minimize stimulation. So then they start to be constantly monitoring and feeling as though their bubby's dialing up is because of overstimulation, when in fact the little one is most likely to be dialing up because she or he wants a change, a richer sensory experience.
So, like, can newborns get bored? Like, is that, when you were describing that, I'm thinking like, oh, maybe there's like bored with this little thing and want something different.
Definitely. So there's this biological drive to be richly engaged in the world right across the sensory and the motor systems. Like it's a fundamental biological hunger. Now, the first couple of weeks, as I say, there's often a lot of sleeping, but you definitely will start to see this emerging after those first days, which are an extraordinary and sort of luminal time, that sort of threshold time where, but as the little one comes out of that and you come out of that as a family, yep, babies get bored.
Yeah. I'm thinking of animals in the zoo when they like freeze a watermelon in a giant ice cube and throw it to the polar bears or whatever. And it's like, here you go. Here's something different. Don't get all bored on us, right? And even as you were describing carrying the baby around, it's like, oh, there's balance and imbalance happening, which actually is so subtle for an adult, but like that's using your brain big time to try to tease out where I am in the world and what's happening around me.
Exactly.
Yeah.
It's like this biological drive for that. You can see from an evolutionary point of view, that's what our Homo sapiens infants have been biologically primed to expect. And the absence of that becomes like a hunger, not as critically life-threatening as the hunger for milk, but actually very, very powerful. And they dial up. I talk about the dial on the sympathetic nervous system. I hope that makes sense. They dial up. That doesn't mean they're needing sleep. We want to take that sleep lens off and just think change of sensory motor nourishment, or of course our go-to in those early days, which is milk.
That's helpful. And when you alluded to strategies a couple of minutes ago around sleep, do you mind just briefly or quickly or however you want to do it, touch on maybe like best in practice or what you are seeing in the literature, the scientific literature around like what is the ideal way to attempt to do all of this sleep stuff? If it's not that way, like what is the way that you're a proponent of?
Yeah. Well, one way of thinking about it is that you actually don't have to do it. We just have to get out of the way of the two biological sleep regulators. So the circadian clock we've talked about, and then the sleep pressure, the sleep-wake homeostat is that other. So if we just are able to keep our little ones dialed down and we focus on that, which means how can we have the most enjoyable life as parents with our puppy, then the sleep really does look after itself. So daylight, noise, activity, having a day outside the home that you enjoy as a family with the little one just expected to fit in. Sleep will happen on and off, but you're not trying to get sleep, not trying to keep the puppy asleep. And then in the night, but also feeling as though it's perfectly fine for the little one to go to sleep at the breast, for instance, or with the bottle if a family's bottle feeding. That's normal because often you get advice that sets up bad habits, which is extremely disruptive to the family sleep ecosystem, that advice, but it's very common still. Misunderstands sleep science. Sleep's not controlled by sleep associations. It's controlled by the two biological sleep regulators. So certainly...
I'm sorry, just to drive that home, that's like the baby could fall asleep with the nipple in the mouth.
They do all the time. No, that's it. Absolutely. And but we also don't want to feel we've got to be burping, holding the baby upright after feeds, because that can be very disruptive to sleep, actually, because the little one's dialed down so beautifully with milk. And then if we feel like, I've got to burp the baby to get good sleep or, to help the baby's gut, then we dial that little one up and suddenly we've disrupted that ease around sleep. Even in the night, I talk about the 4 big disruptors of sleep in the night, the burping, the holding upright, neither of which we have to do. Babies burp in whatever position they're in, you see, and we don't have to worry about that.
You don't have to burp a baby? That seems like such a cool part of our society.
I know, and it's very socially constructed. Most human cultures don't burp their babies, but it is a big thing in the West. But it can be very disruptive, actually, believe it or not. I know it sounds weird.
No, it just sounds different. It's like, wait, and now I'm thinking like, oh yeah, so you have this snoozy, sleepy, drowsy, full baby, and you're like, hang on, let me put you on my shoulder and smack you around and wake you up, right? But I was always, because I grew up with young siblings, and as a teenager, there was always babies around, and it was like, you've got to burp the baby, and then they have like a little bit of the vomit or a little
Reflux,
bit of
yeah.
the reflux comes up, and then it's like, okay, job done, got that out of the way. I always assumed that was for some kind of health reason or preventative. No,
And you will hear, you'll get a lot of advice to do it. Um,
I've studied that, and there's like evidence to.
Well, there is now, I'd have to go and find it, but in the sleep program where I sort of pull out all this sort of evidence base, there's a couple of studies, not a lot. There's not been a lot of work around this in terms of burping directly, but then when we haven't, but there's a couple of studies that did look at burping and
Right.
this, but then we have to sort of start to put together physiological rationales when we haven't got direct evaluation around practices. And there's very strong physiological rationale for what I'm saying.
Well, what you just said is like babies will burp in any position. I was like, oh yeah, that makes sense to me.
Yeah. And, they're not becoming unsettled because of gut pain or air that they've swallowed. The way you get a lot of advice around this. So we started our chat together talking about fit and hold challenges, which can be a real big reason for why babies might be fussing at the breast, let's say. But it's not because of air swallowing, which parents will often be told. It's not because of reflux, even though they puke all the time, but it doesn't cause them pain. We don't have to worry about that. So the burping practices and the feeling we've got to hold them upright can be really quite disruptive to sleep. It sounds like your siblings got by perfectly fine with all that love from their older brother. And, if it works, it's fine. But actually for lots of families, it actually becomes really disruptive, but they don't realize it's being disruptive because they're just doing the best everyone wants to do, what you think is the way to be a good parent. And if you're told to do this, you do it,
Yeah, that makes sense. And I'm imagining an experience whereby you feed a baby, the baby's asleep, and then the story would be, oh no, I need to burp the baby now, or else I'm a bad parent, I'm doing it wrong, they might die, this is bad. And then you wake the child up, and that's causing the disruption.
That's it. Actually, it's a nice little way to kind of illustrate how important it is to listen to ourselves as parents. And if something actually feels like, I don't think it's going to work, this is disruptive, it's making things harder rather than easier, just doesn't feel right intuitively, go with that. Go with your feeling.
Yeah, that's helpful. And my partner I lovingly refer to her as a heart antenna because she's witchy and she's in the woo-woo and she's intuitive and she's found this scientific analytical partner who's very logic and reason based. And so we kind of meet in the middle at times. And so this is just another fun example of like ways for us to come together as we make decisions about our little one.
Yeah, well, good science, and the directions that science takes us.
I mean, oftentimes, Pam, I will share, for example, I'll read an article or I'll read a finding and I'll say something and she'll just be like, well, yeah, that makes sense to me. And I'm like, well,
yeah.
It's just helpful for me to like have the study and the data, Like it makes sense to me too, but like there's a really good p-value here, like.
Well, that making sense to her is very powerful. It'll be an enormous strength, actually. That kind of tuning in and because it's actually this very complex process, isn't it, that she's engaged in because she's reading the world around her, reading her body, drawing on the whole histories of her experience and her sort of knowledge from being alive, basically, blending it all together and saying, yep, that actually makes sense to me. When I listen to my body, I listen to my, so there's a real, I think as parents, that kind of sense making, because your baby will be absolutely unique. Your family is absolutely unique. So it really is true to say that you're going to be the experts on your baby, but it'll just be this experimenting the way through.
Yeah. It's a helpful way to look at it. Yeah, and like one way I've thought about this, and many things actually, is like, oh, evolution has been working for billions of years, and modern humans have been around for a long time. It seems quite ridiculous to think that, oh, they forgot to give you the codes for how to do this core vital biological thing, or like, oh, you forgot to download the program when you were coming through. It's like, it seems reasonable that it's in us.
It's in us, but we live in extraordinary time. I mean, you don't need me to tell you how much disruption there is between the human and the human's capacity at the moment to live on this planet in a way that understands our interconnectedness with our environment. We come from a worldview, us very 21st century Western humans, a worldview that is very materialistic, but hasn't got a good understanding of how the human body operates, if you like, in this cosmos. And so there's very profound disruptive beliefs actually that are normalized throughout our health system. And our science is actually taking us back to a much more evolutionary understanding of what it is to be a parent if we want the best for our babies. That's where all the science is going. But it's not surprising, I think, that we live in this very disrupted time in terms of the advice that's out there. I think we're doing this big paradigm shift back to a much more evolutionarily aligned way of understanding parenting. But I come from an era where everyone panicked about that. The feminists, and I'm certainly a feminist, but there was a lot of panic about this is not workable for women. I remember being in a conference presenting early versions of the Possum Sleep program, and a well-meaning health professional standing up and saying, we're not Kung Bushmen. Contemporary women have very, very, serious work responsibilities. And my position is absolutely, we live very complex lives. But actually the way to make parenting a baby as easy as possible is to bring our strategies back into an alignment with what that baby's evolutionary needs are. That's actually best for parental well-being. Parents find their own way through, and everyone has their own path. There's no simplistic solution here. I'm about workability, not perfection. But we need to have a better understanding of biological expectations of that infant if we're to make life as easy and as enjoyable as possible. And I don't want to forget the other two disruptors in the night, just as an aside, if you don't mind, for completion, because I talked about the no burping, no holding upright. After those first weeks, you don't really need to change a baby's nappy unless there's a poo in the night, but you'll make your own decisions about that because the newborn skin in the early days and weeks is very sensitive. But as soon as we can drop the nappy changes in the night with some good barrier, creams, and then fourthly, very importantly, swaddling or wrapping our baby in the night can actually be quite disruptive of sleep. Now, the message that parents get is that wrapping or swaddling will help your baby be more settled. There's actually not good evidence to show that. And again, I did an analysis of the existing evidence in the Possums Sleep program. And it's certainly, no good evidence to show that wrapping helps with sleep, but it can be quite disruptive in the night because you've got this little one who's just dialed down with, let's say, a breastfeed back to sleep. And then you're thinking, oh no, I've got to wrap the baby, or I've got to zip the baby into their love to dream suit. And next thing the baby's awake, and so you've dialed the baby up again. So that was for completion. I just wanted to finish my 4 great disruptors in the night.
Yeah, I love that. Will you just run through those again, all 4?
So we don't need to burp our bubbies in the night. We don't need to burp our bubbies anytime. Oh, yeah. That's where we got a little bit, we're stuck for a minute.
I took us down a path there.
We don't need to hold our babies upright after feed. Don't need to hold them upright after we've fed them in the night. As soon as possible, we don't need to change that nappy. Being sensible, of course, as parents, but as soon as possible, we don't change nappies in the night. And then fourthly, we actually don't need to wrap our babies in the night, and wrapping or zipping back up into a love to dream suit can actually be quite disruptive for some families in the night.
Yeah. One sort of theme that I'm picking up on here is it seems like a lot of the evidence and research and science is taking us back to simplicity and the old ways and the intuitive ways. And I really appreciate that. And it's something that would make my partner roll her eyes and say, well, duh, of course, Jeremy. But I think there's part of this system that we live in, which is like, how can we streamline? How can we perfect? How can we enhance and make most efficient and improve, etc.? And it sounds a lot like what you're describing here is like, it's good, it's built in. There's no need to try to like do what we do to every other industry, to do that with the basics of raising a new human being. Is that the main takeaway?
I think that's a very nice summary, really, what I've been trying to do, Jeremy. Work with.
Yeah, but Pam, I want the tricks and the snazzy tips and the.
Well, there's a lot of them. Because a lot of it is about repair too. And as clinicians, so I'm always teaching health professionals through the NDC Institute now, teaching health professionals the clinical skills to repair when problems arise, because often they do, So there's a lot of skillful and evidence-based work around how to help things get back into sync when issues arise, whether it is the baby who's crying a lot, or the breastfeeding, or the sleep, and all of that impacts very much on emotional well-being, you see, for parents. So it's all entwined, actually.
Right. And so just to clarify and admit my ignorance, so one of your jobs is to teach pediatricians or to teach baby doctors how to baby doctor?
I am, yes. So for 10 years through the Possums charity, which closed, and now through the NDC Institute, I've taught health professionals, so doctors and other health professionals, how to deal with problems that emerge across breastfeeding, or indeed use of the bottle, but across sleep, across bubbies who are crying and fussing a lot, and how to best support parent mood with a whole range of strategies. Actually, Jeremy, I draw strongly on acceptance and commitment therapy, but also self-compassion. And I think both of those would be modalities that you would enjoy. I think you use them all the time from what I've seen of your work in subtle ways.
Is that my alley? I mean, you don't do bullying and shame-based therapies that enhance the protocols?
Yeah, I never found that worked. No. I know no, that's right. Yeah, and so I teach health professionals. It's online, flexibly delivered, and there's various levels of training. At the moment,
beautiful.
I'm developing up a lactation fellowship, but we do masterclasses, which is just a basic set of skills across those domains, and then people can become NDC accredited. So actually you can go online to the NDC Institute and find an NDC accredited practitioner near you. So we're building up that database. That's what I do. And then there's the parent-facing program. So the Possum Sleep program is there. In fact, gorgeous son has just finished the audio. It's not quite in there yet, but you can listen to it by audio, but there's a lot of text and videos, all user-friendly, all based in the evidence. So it's been a major job to do this big upgrade. There's 4 studies now, Jeremy, that show its benefits, which is there's nothing else. In the alternatives to sleep training, this is the original, like we first published a paper about this in 2014, and it's been adapted in the UK now by Professor Helen Ball at the Durham Infant and Sleep Centre. We've called it Sleep Baby and You. And so people who aren't registered health professionals but working with parents all the time can just do that Sleep Baby and You course. We've got lots of materials that you can use with parents, little animation and stuff. That's on the NDC Institute site too.
Yeah, you have a wonderful online program. I'll put links to that in the show notes for those that are looking at it. But I was reading through just the summary the other day and said to my partner, like, I'm interviewing this lady and I don't know her that well, but like this program feels like in me, like this is resonating, like the way you're talking about stuff and the way you speak and everything. And she was like, oh, maybe we'll check it out. And I was like, okay, yeah. I'm curious, this is maybe a random question, but like we've spoken very eloquently for a while now, but like what would a devil's advocate or someone from the other side that listens to this and like maybe has a Pamela Douglas dartboard out there that's like, you don't understand, she's spreading misinformation, or I don't even know. I don't have the knowledge to dispute anything you've told me today. But like, how would you approach that? Or like, what's the other side? Or what's the other arguments for? Does it make sense?
It does.
Well, actually, before that, are there people that have Pamela Douglas dartboards, do you think? Like, is it that contentious?
Well, I am.
It's not a no, Pam.
I am. Look, I know that my work is disruptive, right? And I've watched, because I've been doing this for a long time, and I've watched international shifts in response, actually, sometimes to my work. So I think I have to come to terms with the fact that I'm a disruptor, and that therefore there will be, as one of my dear friends once said, you wanna contribute to paradigm shift, but you get so upset when the paradigm doesn't want to be shifted. Because I was saying, there's all this pushback and people have said these nasty things, and so it's just understanding one's own. This is what gives me a sense of purpose in life, and they're aside from family and friends, but this is my professional sense of purpose really now, and it is disruptive work, and it is offering paradigm shift, and so there is pushback, and that's an inevitable part of it. So I could look at that both in the sleep domain and definitely in the breastfeeding arena. There's very potent pushback and cancelling in significant respects, but it's not something I like to dwell on. It wouldn't stop me doing what I'm doing. I think it's just people misunderstand what it is to be engaging the research and engaging clinical practice in ways that are different, and get quite unsettled and mistrustful of that, and even frightened of it, and think, oh, that's bad, we've got to shut that down. I think it's just a dynamic that operates in our society, and we are in a time where each of us, all of us, you're doing this, are called to make our own contributions for change, because there's a lot that needs to change in the way we're living as humans. but that is also unsettling. That's how I make sense of it, Jeremy.
Yeah. Yeah, I'm reminded of analogies such as, the people that bred horses didn't like when cars were invented, or the record player companies didn't love when CDs were invented. And I think to be a disruptor in certain circumstances from certain individuals, that is a threat, right? It is a real threat to livelihood. It is a threat to belief systems. It's a threat to ways of living and doing, and that can be scary at times for people. And
that's it.
I just appreciate that you are disrupting in such a wholehearted and loving manner. Like, if you,
Jeremy,
you seem so mellow and so soft-spoken, and it's like, I just appreciate your way of disrupting. And it sounds like there might be, with different opinions, etc., conflicting intentions or desires, where it sounds like you're very science-based, pursuing truth, trying to do what's best for the babies. Just seeing your face when you talk about babies, I'm like, this lady seems like she cares. I don't know if she's dartboard material, and you're trying to get at ways to improve families and improve babies and have us all live easier, healthier lives is what I'm taking away. Is that accurate?
Yeah, thanks, Jeremy. That's absolutely accurate. Certainly.
I mean, you have a knitted boob next to you, and you have a fake baby at your feet just randomly. It's like
fake. Timo's he's got his own being, Timo.
He's right there. I'm sorry, Timo. He can hear your energy. Yeah. Okay. Well,
Jeremy, it's been a real pleasure.
Yeah, you're very welcome. I appreciate you taking the time and sharing so openly with me and letting me pick your brain. And
be keen to hear how it all goes with your family.
Well, I am also keen. I mean, you might get a SOS distress email one day, Pam, saying, "Hey."
Well, you're welcome. You're welcome. I've very much enjoyed our chat, and you'd be very welcome to get in touch.
Thank you very much. Yeah, and to those listening, check the show notes. I'll put links to everything. Pam Douglas, but is there anything we didn't touch on or anything you want to say?
No, I think it's the possumsleepprogram.com, the health professionals. It's the NDC Institute.com.au. And actually, for providers who may not be registered health professionals, there's courses there as well. And I guess the Discontented Little Baby Book that's now available in Dutch, and it's being translated into Italian.
So
I'm excited to say. Amazing, really.
That's so cool.
So I think that's it. The big breastfeeding thing is underway. We're thinking the end of October, mid to end of October, there'll be the Possums breastfeeding work happening, but it's not inside the sleep program. Actually, the Gestalt method, I've just put all the basics around the Gestalt method inside the sleep program, so it's still available for parents. But all of that will be much expanded come October. drpam.au.
Whatever it is, yeah.
Yeah, I can't remember actually.
Yeah,
you'll get it.
Yeah, I'll track it down. I'll message
hear my son saying,
"Yeah,
seriously, don't know the URL."
Yeah, no worries at all. And thank you again. This has been great.
Thanks, Jeremy. It's been a real pleasure.
Okay, that was Dr. Pamela Douglas. As mentioned, I've put links in the show notes. You can check out her Possums Sleep Program. You can check out the NDC Institute. You can check out her book. And thank you. Thanks for being here. I hope that was helpful. I thought it was super helpful for me, practically. I feel much better prepared. I feel like I've learned a lot from talking to her. And I hope the same is true for you. What else? You can find me everywhere online at Long Distance Love Bombs. Thanks for being here. Leave some 5-star reviews. If you've got people or topics that you want me to cover, please do reach out and let me know. And maybe share this with a new parent or somebody you know that's pregnant and say, hey, yo, this is helpful. I thought of you. I thought this might be helpful. That's all I got. Thank you for being here. Thanks for the support. And keep making kindness cool, including yourself. When you look in the mirror, if you're not compassionate to yourself, it's much more difficult to be compassionate to the world. Love you. Appreciate you. Talk to you soon.